Physiowebseries Shoulder Complex Season 1. Let's begin with Series 2. Study of the bone, humerus. Let's have a look at the attachments of humerus. So, if we consider the superior aspect of the humerus, greater tubercle is occupied by supraspinatus. Posterior or inferior to that will be infraspinatus and teres minor. And at the lesser tubercle is subscapularis attached. Detailed view to consider about the rotator cuff muscles attached at the superior aspect of humerus. As we can see in the diagram, supraspinatus is located at the superior facet of greater tubercle. Middle facet of greater tubercle is occupied by infraspinatus, and inferior facet of greater tubercle is occupied by teres minor. So the point to be noted is that supraspinatus occupies most superior position at greater tubercle. This was in posterior view. Now coming to anterior view to appreciate the lesser tubercle of the humerus where subscapularis is attached. Now, if a physiotherapist wants to palpate the rotator cuff muscles on a patient, we can refer this diagram as shown in anterolateral view. A therapist can place fingers such that thumb will occupy lesser tubercle and index, middle and ring finger will occupy greater tubercle. And if we place, as shown in the diagram, considering the anterolateral view of the humerus, then our thumb will occupy subscapularis muscle, index finger will occupy supraspinatus, middle finger will occupy infraspinatus, and ring finger will occupy teres minor. Moving on to a broad view to have a look on rotator cuff muscles. If we consider the anterior view, we can appreciate supraspinatus, which is superiorly located at the superior facet of greater tubercle, and the subscapularis, which comes from subscapular fossa to the humerus, and that too lesser tubercle of the humerus present anteriorly. In posterior view, supraspinatus, infraspinatus and teres minor can be appreciated well, which come and insert on the greater tubercle in a manner that supraspinatus at the superior facet, infraspinatus at the middle facet and teres minor at the inferior facet of greater tubercle. We saw the greater and lesser tubercles of the humerus and the muscles attached to it. Between the greater and lesser tubercle, there is intertubercular sulcus or the bicipital groove. Now, what's in the bicipital groove? Let's have a look into it. We can see that the long head of biceps tendon passes through this bicipital groove. There is transverse humeral ligament which holds this long head of biceps tendon in the bicipital groove. Now, if there is tear of this ligament, it will cause the long head of biceps tendon to flick out or pop out of this bicipital groove. To check the integrity of this ligament, we physiotherapists have a magic tool. What's the magic tool or the key of a physiotherapist to assess in patients? It's the special test. So in this case, to check the integrity of this ligament, we have a special test called the Jorgensen test. So what's this test? The patient will resist supination movement and at the same time will be asked to perform lateral rotation. If while performing this test, there is popping of the tendon, that is biceps tendon, that will indicate the tear or laxity of transverse humeral ligament. But if there is only tenderness at this point, that will indicate bicipital tendinosis. Let's see something more interesting about the bicipital groove. We have come across this famous mnemonic, lady between two measures, where the word lady represents latissimus dorsi muscle and the two measures represents pectoralis major and teres major. Now their position around the bicipital groove is such that the floor of the bicipital groove is occupied by latissimus dorsi and the lateral lip of the bicipital groove is occupied by pectoralis major and the medial lip of bicipital groove is occupied by teres major. Hence we say that lady between two measures, that means latissimus dorsi is present between pectoralis major and teres major. Deltoid tuberosity of the humerus. It is present anterolaterally in the humerus as seen in the anterior view. It can be appreciated in posterior as well as anterior view as can be seen in this diagram. This deltoid tuberosity has the insertion of deltoid muscle to it. Some interesting facts to be noted for the clinical aspect regarding deltoid tuberosity. Deltoid tuberosity is the common site for referred pain because the rotator cuff is the integral part of capsule and ligaments of the shoulder. So, muscles of the rotator cuff as well as the capsule of shoulder may refer pain to this deltoid tuberosity.